Coming up, I closed my business this week. I've run a theatrical agency for 15 years with 40 professionals depending on me to find them work. Brexit and the loss of work opportunities within the EU has been a major factor in my decision to close. But time to move on, the Brexiteers tell me. After all, the creative industries aren't important, are they? According to the increasingly obnoxious Rishi Sunak, for example, we should all learn maths instead and all become automatons working as minimum wage drones in data processing for global corporations instead. So yes, I am still talking about Brexit and I won't move on. In this video, for example, I want to look at a particular Brexit-related crisis that is surely in all of our minds right now, and that's the one playing out in the National Health Service. £350 million a week extra, the Brexiteers said. Were they having a laugh? The Nuffield Trust is an independent health think tank providing evidence-based research and policy analysis, and they've just produced a damning report detailing the crippling damage being done by Brexit to our cherished National Health Service. Stay tuned. If you enjoy watching the Truth to Power channel, I'd really appreciate it if you'd help me out by hitting the like button and especially by sharing a link to this video on your social media platforms. Brexit has changed the UK's relationship to the European Union forever. No matter that opinion polls are now showing 2/3 of the electorate now regret Brexit and want a second referendum, it's far too late. The deal we had as an EU member will never ever be offered to the UK again. Ever. We now know that the whole Leave campaign was based on lies and empty promises and has impacted just about every aspect of UK trade, its economy and British society as a whole. But in this video, with the NHS at breaking point, I want to take a look at how the Brexit deal has specifically impacted health provision in post-Brexit Britain. Even before the referendum, we knew that leaving the EU would specifically mean reducing the availability of migrant staff on which the NHS has long relied. Plus, risks of supply chain issues for medicines, which are mostly imported from the EU. And more generally, the impact Brexit is having on inflation, cost of living and loss of funding for health-related projects is also having a powerful effect on health outcomes for the population as a whole. The trouble is, the impact of Brexit comes on the heels of 3 of the most difficult years in the history of the NHS. The service was struggling to secure enough key staff and failing to deliver on waiting lists, even as the stupidity of the EU withdrawal agreement played out. And on top of Brexit, the NHS has faced by far the largest pandemic in its history, leaving it with a larger backlog of treatment, lower rates of healthcare activity and exhausted staff. Brexit has just been one more blow to a health service already stretched to breaking point. The independent Nuffield report tells us that across medicine, nursing and social care, there has been a decline in recruitment and registration from the EU ever since the referendum in 2016. There was already a lack of appropriately trained healthcare workers due to a lack of workforce planning, inadequate government funding for fair pay for health workers, unappealing conditions, and a growing demand for increases in staff due to our ageing population's health needs. But with Brexit choking off the freedom of movement of people, this shortfall in staff is even worse now. It's true that a rapid increase in recruitment from the rest of the world has partly compensated for the slowdown in EU workers, with the number of nurses joining the UK register from the rest of the world rising to 18,000 in the past year. But that's still nowhere near enough to make up for ongoing shortage of nurses, which currently stands at around 40,000 unfilled vacancies. And it's not just nursing. Some essential medical specialisms have been left behind in this general shift from EU to rest of the world recruitment. Anaesthetics, a fundamental core specialty within the NHS, has shortages which are having serious consequences on the surgical waiting lists. A large proportion of anaesthetists in the NHS were from the EU, But since Brexit, the rate of recruitment has dropped by 3/4, and non-EU recruitment has also fallen, so there's no chance of replacing those potential EU recruits lost through Brexit. And it just gets worse. We all know that in nearly every area of the country, it's almost impossible to find an NHS dentist as a new patient. Well, the rate of EU and European Free Trade Area dentists joining the register has also halved since the EU referendum, without a clear increase in rest of the world registration to make up for it. We're told that a lot of the current NHS backlog is caused by 12,000 people occupying hospital beds even though they're fit to be discharged, because there is no social or community care available for them to be sent home. And surprise, surprise, social care has also seen a drop in EU and EFTA nationals, which has not been made up for by rest of the world recruitment. But apparently the Brexitists knew exactly what they were voting for. What sort of person would ever knowingly vote for this state of affairs? I dare say that many of the gammons shouting loudest for Brexit wouldn't care that the UK health system is not supposed to actively recruit staff from red list, less well-off countries that themselves have structural workforce shortages. And those people probably wouldn't also care that recruitment from these countries has significantly increased since Brexit. The UK has loosened migration rules affecting health workers from those countries, and so, for example, nurse registration from those poorer countries has gone from next to nothing before Brexit to now close to 1,000 nurses a month. If you're not a flag-shagging Brexiteer and actually care at all about these less well-off countries, this raises an important ethical issue about the damage to health provision in those countries where these health workers were actually trained in the first place. And it's not just woke lefties like me that are concerned about this. The World Health Organization has expressed concerns at Britain's post-Brexit policy of recruitment, and even the Conservatives I know are also troubled by it. But back to the Nuffield Trust report, which also looks at the wider indirect impact of Brexit on the provision of healthcare in the UK. They found clear evidence that Brexit is likely to be reducing the incomes of people in the UK relative to a doppelganger equivalent that remained a member. This is because of Brexit's impact on the size of the economy, productivity, investment and trade. They remark that this is likely to mean an additional reduction on already falling real incomes, pointing out that the link between health and income is well documented and is likely to lead to worse health outcomes and higher demands on the NHS as an indirect but definite result of Brexit. The Nuffield Trust report also highlights multiple spikes in shortages of various medicines sourced from the EU since leaving. This doesn't surprise me personally, as my own wife has been without her medication for a chronic ear, nose and throat condition for several months now, leading to daily discomfort. Thanks again, Brexit. The Nuffield Trust report says that drops in the pound due to Brexit and the disastrous Truss-Kwarteng fiscal statement also make it difficult for the NHS to obtain medicines under the cost controls it has relied on, and also point to Brexit's impact on the shortage of goods vehicle drivers, worse in the UK than any EU country, and the additional non-tariff barriers and red tape at our borders. For other G7 states, medicine imports have risen steadily in total value since 2016, but in the UK they have reversed and fallen back to where they were a decade ago, which is probably due to these new post-Brexit trade barriers. Nuffield Trust Brexit Programme Lead Mark Dayan summarised the findings of the report in a short statement. The effects of Brexit appear to have added to the severe challenges and problems the NHS currently faces. The economic hit, combined with the worst cost of living crisis for a generation, is reducing living standards, creating additional need for health and care. The fall in the value of the pound, coupled with increased trade barriers, are probably major factors in our unusually consistent and long-standing problems supplying vital products. Now, I try to read all the comments left on this channel, even the ones from members of Idiot's Corner. Brexitists who say that Brexit was never about trade, it was never about the economy, it was never about the money, it was all about sovereignty, innit? immigration, and freeing ourselves from the shackles, apparently, of EU dictatorship. These chimera, these indefinable and mythical unicorns in the sunlit uplands of Little England, oh, and Wales too, of course, these things are apparently of greater value to Brexitists than the economy, standards of living, the loss of jobs from the closure of thousands of businesses like mine or of my good friend's YouTube commentator Michael Lambert that relied on freedom of movement of goods or people. Let's see what we get from Idiot's Corner this week. But I'm fully expecting some comments claiming that this mythical idea of world-beating isolationist British sovereignty is somehow even more important than a functioning NHS able to care for our sick and dying loved ones.
Welcome to the Brexit, sir. I'm sorry.
Oh my God.